Hi everyone. Today our focus is on Graves' disease, which is an autoimmune disease that affects the thyroid gland. This disease presents unique challenges in endocrinology, and understanding its complexities is vital to becoming a better healthcare provider. Join me as I shed some light on the fundamentals of Graves' disease, explore its pathology, clinical presentation, and therapeutic approaches. Thyrotoxicosis is the clinical syndrome that results when tissues are exposed to high levels of circulating thyroid hormone. In most instances, thyrotoxicosis is due to hyperactivity of the thyroid gland, which is also called hyperthyroidism. Hyperthyroidism can be caused by many factors, but the most common cause is Graves' disease. I will get into more of those details on a later slide, but in general, Graves can cause a series of unwanted and uncomfortable symptoms. If left untreated, it can cause serious long-term health problems. On the next two slides, I will talk about the common signs and symptoms of Graves' disease. The symptoms listed here are not all-inclusive, and not all individuals will experience all or any of the symptoms. Many individuals experience a rapid or irregular heartbeat, which can lead to anxiety or discomfort. Unexplained weight loss often occurs despite an increased appetite. This happens because the body's metabolism is increased. Shaking or tremors, particularly in the hands, can be noticeable and distressing. Many report feeling tired and may experience weakness, particularly in the upper arms and thighs. Goiter, which is characterized by an enlarged thyroid gland, will appear as swelling in the base of the neck. Hair can become fine and brittle, leading to hair loss, and various psychological issues and changes in menstrual patterns can be attributed to Graves as well. This next set of symptoms may be the most well recognized when it comes to Graves' disease. However, it's important to understand a few key points. Thyroid eye disease, which I'll subsequently refer to as TED, and Graves' disease are different, and they need different treatments. Even though bulging eyes are one of the most commonly recognized symptoms, that occurs in only 1/3 of people with Graves' disease. There are a few reasons for this confusion. One is that TED and Graves' disease are both autoimmune conditions. With Graves' disease, the immune system attacks the thyroid, but in TED, the immune system directly attacks the muscle and fat tissue behind the eyes. The fact that people with Graves' disease often develop TED also causes confusion. However, a person can develop TED without even having Graves' disease. Additionally, people use a number of different names for thyroid eye disease. Some of these even contain the word Graves. If you read or hear any of these terms listed here on the bottom right of the slide, know that most mean thyroid eye disease. In any case, the distinct bulging of the eyes from thyroid eye disease or Graves can be seen in these photos. Next, I want to talk a bit about the thyroid gland itself and the hormones it produces. The gland is butterfly-shaped and located immediately below the larynx in the anterior middle portion of the neck. It is composed of many tiny sac-like structures called follicles, which are the functional units of the thyroid. The two main hormones the thyroid releases are T4 and T3. These hormones go on to regulate various body processes such as temperature and metabolism. To start this feedback loop, the hypothalamus releases TRH, which in turn stimulates the pituitary gland to produce and release TSH. TSH then triggers the thyroid to produce T4 and T3. The thyroid also needs adequate amounts of iodine to create these hormones. That's an important detail to remember when it comes to treatment, which I'll get to shortly. We know that Graves' disease is an autoimmune response, but with any autoimmune disorder, the cause is not always known. Genetic factors, environmental triggers, and hormonal influences could all play a part. What we do know is how the disease acts. In a nutshell, the disease causes the thyroid to produce excessive amounts of T4 and T3, which I mentioned on the previous slide, and that causes a negative feedback on the pituitary and hypothalamus, resulting in decreased production of TRH and TSH. The end result is raised T3 and T4 and low TSH, which yields in an overactive thyroid, which I keep referring to as hyperthyroidism. This next slide talks a little bit about the incidence and prevalence of Graves' disease. In the United States, Graves affects about 1% of the population. It's the most common cause of hyperthyroidism in the country. Women are 5 to 10 times more likely to develop Graves' disease than men. And about 50% of people with Graves' disease have a family history of autoimmune thyroid disease. Diagnosing Graves' disease typically involves a combination of clinical evaluation and specialized tests. Typically, providers will order labs in combination with an ultrasound to rule out cancer or other sources of inflammation. Once results are obtained, the provider can plan for treatment. Blood tests show the levels of TSH and thyroid hormones in the body. People with Graves' disease most often have lower than usual levels of TSH and higher levels of thyroid hormones, as I previously mentioned. Orbital imaging in the form of a CT scan or MRI might also be needed for those with thyroid eye disease. Luckily, there are several options when it comes to treating Graves' disease. Antithyroid medicines block the thyroid from using iodine to make the hormones that are being produced in excess. These prescription medicines include propylthiouracil and methimazole. When either of these medicines are used without other treatments, hyperthyroidism may come back. Antithyroid medicines may be used before or after radioiodine therapy as an added treatment. Radioactive iodine therapy is a treatment that uses radioactive iodine in the form of a pill, ingested liquid, or administering a shot that delivers radiation to the thyroid. The gland then absorbs iodine, which will then destroy the thyroid cells, effectively ceasing the thyroid to produce any hormones whatsoever. Lastly, surgery to remove the thyroid, called a thyroidectomy, can treat Graves' disease as well. With both radioactive iodine therapy and surgical removal of the thyroid, you would need to take synthetic thyroid hormone replacement for the rest of your life. Graves' disease is a lifelong condition that can be managed with treatment. A small percentage of people with Graves' disease may go into remission, but that could only be temporary. Untreated or poorly managed Graves' disease increase your risk for heart problems like arrhythmia, which would increase the risk of stroke or heart failure, osteoporosis, thyroid storm, which is a complicated but rare medical emergency, and vision loss if thyroid eye disease related. As I wrap up this presentation, it's clear that Graves' disease presents significant challenges, but by understanding its complexities, we can navigate through them effectively. Luckily, early detection, comprehensive treatment options, and collaborative efforts between healthcare professionals and individuals provide hope for those affected by this condition. I appreciate your attention today and encourage you to connect with me if you have any further questions. Thank you.